Okay, could we just briefly, and I'm watching the time, we've had such an interesting morning with lots of good questions that we're getting close to the closure time, but in the last few minutes, could I just ask, do we have any information about other inflammatory arthritis problems, Henning? Any other trials in any other areas, such as gout?
Well, as you may know, we have conducted a trial, not yet published, with gout, and I can say that the results are so positive that it should be definitely implemented worldwide. But we are struggling with the final statistics. But people with gout can lose weight, get better. Their uric acid decreases. They don't get gouty attacks as we would have expected with the major weight loss. But exactly the same program as I showed you for the knee participants has been conducted with gout with very, very positive results.
Yeah, thank you. There is a question from earlier on in the day, which was addressed to Mike. What is the position with regard to using partial meal replacements? In other words, is there scope for using a mixed conventional meal and 1 or 2 meal replacements per day?
Well, I mean, I would have to agree with Henrik and with Shahrad on this score, that if you give people the option of chopping and changing, and the element of choice comes in, then there's an immediate opportunity for slippage. And I think our patients, we have detailed qualitative analyses of this as well, our patients found the discipline being restricted for a short period, and well, short is 12 weeks short. I don't know, it was regarded as acceptable, that the discipline of saying, no, I'm not going to a restaurant, I'm not eating with my family, I'm not eating, I'm not having a nice latte in a restaurant with my friends. I'm going to take this very seriously, as you would the treatment for a cancer. We're going to take this seriously. You're going to hope for a remission in 3 months and take it very seriously. And that discipline rang a bell, and they were able to adhere to it. And the minute you start offering, oh, well, you can have 2 meal replacements and something different for your evening meal, which has been proposed in other areas, that does introduce slippage, and the patients tend to do less well.
Yeah.
Have some experience in managing relapses, so patients who start to regain weight. And one of the things we did in Direct was to offer them a short course of total diet replacement, or the use of meal replacements at that stage. And the ones who had the total meal replacement are actually attended. I think as much as anything, it was the actually attending the clinic, which was the prompt, whereas those who used just meal replacements didn't do so well.
Yes. Okay. Well, thank you very much indeed. I'm afraid the time has run out. So thank you very much indeed for your participation, splendid presentations. We've had a very good discussion. Thank you very much to the Secretariat as well, Felix and Andrea, for organizing this. Thank you to the over 100 delegates who participated and for sending their questions through to us. There will be recordings later on. Please can I encourage you to complete the evaluation forms. I'm sorry, Carol, we didn't have a question for you in the discussion, but it all worked very well, I think. I may have to be a little bit hesitant, but I have a feeling we may well organize a follow-up event sometime in the autumn. So we've had a great time. Thank you. You can go to the website and look for the recordings and the other files related to this meeting a little bit later on. Thank you. I wish you a very pleasant summer if you're in the Northern Hemisphere. I know there are people watching from the Southern Hemisphere. For them, I suppose it's a pleasant winter. I wish you well. Thank you very much for your participation.
Thank you.
Thank you. Bye-bye. Bye.
Cheerio.
Bye-bye. Just press leave, Henning, in the bottom right-hand corner. Bottom right, okay? Just press that.